your way at this time. Good evening. How are you?
I'm doing great. I'm doing great. I'm hoping everybody's doing well also. Always good to chat with everybody. And of course, this is our last day of 2025. Looking forward to 2026. And so that's, so we're hoping that everyone has had a great year and is looking forward to this next year. I think we've done a lot of good things. We've put a lot of good information out there. And hopefully people have learned something from it. I think this is a great platform. It's a historic platform, and so I'm hoping that that not only have people learned, they put stuff into action, and that this new year, that hopefully, like I said, they turn those, they turn what they've learned into even further action. Hopefully, setting up goals and going forward like that. So that's what I'm hoping. That's what I'm hoping. That's what this whole program is for. And it's been good to chat with everyone down there and chat with folks online. And so, like I said, we just kind of hope this continues going forward. Okay. So that's pretty much it. So for today, we're gonna get started again. So of course, good afternoon, listeners. You're locked into WVOE, the voice of Ebony, where your health is our heartbeat. I'm your host, Dr. Christopher Brown, president and founder of PressureMD Academy, welcoming you to another enriching session of Health Facts, the show where wisdom meets wellness and knowledge is always in season. So, all right. So we got that going on here. We've done our introduction here. And like I said, we have done a lot of great work, a lot of great information over the course of this year. I think this is going into year number 3 of Health Facts, if I remember correctly. Like I said, yet again, we just always remember what we've done here. So today, we're going to be talking a little bit about, what you can do now to kind of set yourself up for a healthy new year. And, I'm hoping that everybody continues. Wait a minute. Okay. Um, and hoping that everybody continues this health journey. Because remember, I just want everybody to remember that this is, it's a marathon. It's not a sprint. It's a marathon. And that, as we go forth, you know, as you set this health journey, and that's whether you're at the end, at that point where you are pretty comfortable with health information, you kind of research things on your own now, or you're looking into resources, or whether you're still at the beginning. Maybe this is the first time you've heard this program, and you know for all those folks, we want to tell everybody to make sure that they start wherever they are. Don't feel like I said, especially for those people that are at the beginning, or like I said, maybe you don't feel like you know a lot. Everybody has to start somewhere. Said I'm a doctor, but guess what? I had to start somewhere. I had to start at a point where I didn't know the information I know now. So it's the same thing for you. So you start where you are and you build on it. And a lot of that stuff is going to be, a lot of it is just education, learning, being willing to learn. I think, and one thing that about learning that I want everybody to remember is that, a key component to learning is humility. And it's a key component to, of course, for WVOE, it's a Christian radio station, but even for the listeners online, we got to remember that humility is a huge part of the learning process. You have to be willing and able to learn. And, if you have that willingness to learn and you have that humility, there's really, for most people, there's really not a lot that you can't achieve. And so, whether that's, whether you're starting as a morbidly obese person, somebody with uncontrolled hypertension, you know, that being willing to learn and humbling yourself is kind of that first step as we go there. Okay. Um, so, so we want to make sure that we remember that part, because that's how you make it through your goals, is by being humble, being willing to listen, being willing to learn, being willing to explore, being willing to ask. Because some of these questions, sometimes people don't ask questions because they feel embarrassed, or they feel like, they should know it, or they should, or it may reveal a part of them that they're uncomfortable with. And so you have to be willing to learn. You have to be willing to humble yourself as you're going through this process. And also remember, you're not going to do it all in one day. Okay. So if you're in a state that is not terribly healthy, um, you know, if you're in a state that's not terrible, it's not extremely healthy, you know, embarrassment a lot of times keeps you from getting the things that you need to achieve. And so if you are willing to kind of open yourself up, you could achieve a lot. I've seen people that have a lot of comorbidities that tackle them one by one. Said, they may start out with, the diet, and then, like I said, as they achieve their diet goals, then they move on to their exercise goals or movement goals. And so, you're able to do that, step by step. Um, and so I just want people to remember that as we go through this journey, because like as we start 2026, we'll probably start pushing for a little bit more. I'm going to start seeing if we can find anybody that might want to be part of this program as well. Hopefully we'll get a little bit more feedback as we're having our live sessions, and make this a little more interactive, a little more engaging. Um, and Yeah, yeah, and just kind of going forward for that. So, for those that are out there that are listening, if you have any ideas, feel free to reach forward. Any critiques, all that stuff will kind of help us as well. Um, so yeah, so for today, what we want to do is we're going to talk a little bit about things you can do now to kind of help yourself, kind of going towards a future. And I think we talked a little bit before about the importance of goal setting, not just resolutions, but actual goal settings. And we talked a little bit about the SMART goals and how you can use that to kind of set achievable goals. And I think it's really important to kind of remember that, because that's kind of the framework for whatever you're doing. So, and that SMART goal may relate to, like I said, eating, exercise, sleep, stress, or it may revolve around, maybe you already have a chronic condition that you now want to that you might want to want to challenge. So maybe you have high blood pressure, but you've not been taking your medications. And so your New Year's resolution may be number one, and this is for everybody, and that is doing a medication reset. And that medication reset is where you kind of go through, get all of your pills, make sure you know what your pills are for. When you get a prescription, you should know what that prescription or what that pill is treating. Okay. So it shouldn't just be, oh, I got 10 medications. I don't even know what this stuff is. I got so many medications, because I see this a lot where, where people kind of just kind of become very dismissive because they have a lot of medications. So one of the first things you want to address is the number of medication, because people are like, oh, I got all these medications I got to take. Always go back to your especially your primary. Start with your primary. Have them help you go through the list of medications that you have, and they should have a reason why you're on every medication. Now, it may be that they, like I said, hey, there's a medication that you're on, you know, I know what it's for generally, but it was written by another doctor. Okay. And so if that's the case, they may send you to the other doctor to find out why that medication is being prescribed. And I think that that's fair. Okay. And they may ask, say, hey, look, under what conditions can you come off these medications? Because there's a condition called polypharmacy, right? And that's basically, when a person has a lot of pills. And sometimes those pills can be reduced. Okay. So, people are placed on medications, vitamins, supplements. Some of those are prescription, some of those are not prescription. And so one of the things that happens is that, once you get, the more pills you take, the easier it is to forget to forget medications. Also, like I said, the more pills you take, the more side effects you can get. So sometimes, at least once a year, once every other year, if you're taking, a number of medications, you might want to ask, say, hey, look, can I reduce the number of medications that I'm taking? And that's a fair question. And sometimes and when I see my patients and they have those conditions, I'll look through again, because it's a couple of things that can go on. Maybe you have a condition that has been treated, but for whatever reason, this medication still on there. That medication can come off. Sometimes, especially stuff like, vitamin supplements. Sometimes we prescribe vitamin D, vitamin B, calcium supplements. Sometimes we will write these, you can say, hey, what are my most recent levels? And you can come off of them. Now, there's some like vitamin B12 is a very popular vitamin that's prescribed by a lot of physicians. And it might be prescribed because your vitamin B12 was low, and then it gets, higher in the normal range or sometimes even high. Now, some people may feel like they need that it works, it gives them extra energy, so they may want to take it. But other people, most people can come off of that medication because what will happen is that a year later, we'll check the labs again, and if the remains normal, fine, you don't need to go on it. But if it becomes low, you can go back on it. So there are a number of medications that are like that. So you want to make sure that you're finding out which medications you absolutely need, which ones are optional, and which ones you just need to come off of. The other thing that goes on that as time goes on, sometimes a new medication will come out that has more than one pill. Okay, so there are some of the blood pressure medications have two medications inside of it. So instead of you taking two medications, you'll only have to take one. There's even one pill where it has three blood pressure medications in one pill. And so you can ask around, ask your docs, especially if you have high blood pressure, hey, look, can I get one of those combination pills if you have more than one blood pressure medication? So you can always ask those questions. Now, sometimes it's a transition period as you come off of the three onto the one. So, you may need a few more lab checks or a few more blood pressure checks in order to get to that point. But that stuff can happen. The other thing is, like I said, sometimes they may have, there might be a new tablet that can keep you from taking, say, 3 or 4 tablets a day and only taking one tablet a day. So those things can happen from year to year as new medications come out. So you can always ask to see if there's a way to reduce the number of medications you're taking. So when it comes to medication, number one, once a year, once every other year, really once a year, you want to go through your medication that you've been prescribed. Number one, make sure you know why you're taking that medication. Okay, make sure you know the condition. And like I said, every tablet has a condition or what we call a diagnosis that's attached to it. So you want to find out what that is, and then you want to find out, once you find that out, then you want to find out, hey, can I reduce the number of pills that I'm taking? And that could be a matter of coming completely off of medication. It could be from going from multiple pills a day to maybe one pill a day. So those are ways to consolidate and to make it easier to take those medications. So those are the things. And then a special caveat especially for those that, even after all this is done, you still need a number of medications. There are certain companies that will, because sometimes, if you got multiple medications, you're trying to figure out what's what. There are companies that will actually take your pills and it's almost like they pre-package them so that, morning, noon, night. And so they'll put all your morning pills in one little blister pack, your afternoon pills in a blister pack, and evening pills in a blister pack. And it's a way that they can simplify your medical regimen. So they have to know what's going on there. Of course, you have to know. And like I said, they can help to get your medications in a manner that is easier for you to take. Okay, so that's another thing that can happen as well. But the other thing that of course everybody has access to are those little pill boxes. So you can always use one of those. I'm sure that I haven't checked it out. I might check this out and do a show on this because there may be some. There's likely some that are now where you're able to, it may send reminders and stuff of that nature that go on. I know that the iPhone has a setting where it can kind of remind you about pills that you're supposed to take as well. So I think during this year we'll probably go into some how technology can help you to remember to take your pills because adherence to your medications is extremely important. Okay, so that's kind of your medication reset. So like I said, again, so I know I feel like I feel like I'm repeating myself a lot, but I know that you're supposed to say things over and over again, and that is number one, you want to get all your meds, so get everything. Make sure that you may want to make a appointment just to kind of review your medication, so a medication review appointment. So you want to make sure you know why you're taking medications, why you're taking medications, Do you still need this medication? Um, are there ways to simplify your medical regimen? And if you still have a number of pills, even after simplifying your regimen, are there any services or technologies that can assist you in and being adherent to taking your medications? So that's kind of your, what I call your medication reset. Okay. So that's something we want to focus on for 2026. So we want to make sure we get this stuff under control, because this is a thing. And if you're not taking your meds on a regular basis and you're going to see your clinician and they're checking your A1Cs, they're checking your blood pressure, they're checking your cholesterol, and those things are out of control, make sure you let somebody know, because you know you know the doc, the NP, the PA's decision about changing your medication is based off of assuming that you're taking the medication as prescribed. I can't tell you the number of people that they will come in, their blood pressure is not controlled. I make medication adjustments, and it's kind of the end of the session, and they're like, well, I just want to let you know, I really ain't been taking this. And I'm like, okay, you just messed up the whole plan, because my plan is based off of you taking the meds. And then I have to send them home. Hey, go home, take your medication on a regular basis, check your blood pressure. Then we got to set up a whole nother appointment, because you failed to reveal that information. And it's not safe to make some of these medication adjustments if you are not taking them appropriately. And yet again, I'm a kidney and blood pressure guy, so I focus on blood pressure. And one of the things that, every now and then we'll see in the hospital is someone comes in the hospital, with, particular condition. They list out all the meds, they give them the medications, and later on they're having complications like a low blood pressure. Why are they having low blood pressure? Well, they gave a list of medications that they actually were not taking. And like I said, and over the time, people have been increasing these medications. So this is why medications are important. And this is one of the reasons why we want to do a medication recheck. We want to make sure you have an accurate list of your medications, you know why those medications are being used, and that you are keeping up to date on this. Okay. So this is very important to your medical health and making sure that you're getting yourself well. Okay. All right, so that is kind of our medication reset for today. So we talked about that. I think it's important. And yes, I've repeated the same thing multiple times, because I really, 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 really want people to make sure they understand that aspect. It is extraordinarily important. Okay. So that's one thing. So now as we go into 2026, the other thing that I've seen that I really want people to kind of focus on and make sure that they're getting under control, or learning, and that is certain conditions you can actually get education for. And one of the big ones is diabetes. I actually encourage people to get diabetes education earlier rather than later. And I've noticed that, sometimes people are never offered diabetes education. Now, sometimes they're offered, they don't go, but then a lot of people I'm finding just are not offered diabetes, kind of diabetes education. And I think it's very important for you to understand your condition, whether it's diabetes, hypertension, high cholesterol, whatever your condition is, it's very important that you understand that. And the difference between, a medical professional's knowledge of your condition and you understanding your condition is huge. And it goes into, how things are managed, how you are approaching your health care, and whether or not you have good outcomes. Because it's really painful sometimes when I see people that have kind of long-standing diabetes, complications from diabetes. And I asked them, have they ever been to a diabetes educator? And they don't, not that they haven't, been, but they don't even know what that is. And I'm like, okay, look, you've been in control for a while. Somebody should offer this to you. So what I'm doing is I'm taking this message out to the people so that you can know to ask for diabetes education. Okay. And if you have trouble, reach out. Like I said, we'll see what we can do to get you connected to someone. Okay. And that's wherever it is. Like I said, reach out, say, hey, I don't have a diabetes education. I never had diabetes education. Can you help refer me to someone? And then we can, like I said, we can help navigate you to resources in your area that can provide that to you in case you're out of our if you're out of our reach, okay? But what we're hoping to do with PressureMD is to actually kind of go into that space and provide a more physician-led health education about some of these diseases because the education piece is huge. And it's like the more you educate, more people know about this stuff, the more they can become their own agents in their healthcare. And it doesn't extend, like yet again, I'm the high blood pressure guy. We'll start with high blood pressure guy, but like I said, as they understand that blood pressure, then they want to understand the diabetes. Understand the diabetes, you want to understand the cholesterol. Understand that you want, we'll reach out to the heart health. And then a lot of times, of course, I'm a lifestyle medicine a doctor. So, of course, we try to tie all this stuff into the choices that you're making every day and how that impacts the different conditions you have. Because a lot of these conditions that I'm talking about are what we call chronic diseases. And a lot of those chronic diseases are driven by everyday lifestyle changes. Last week, we talked a little bit about, how the holidays will a lot of times will derail people's health plans and and what they've been doing throughout the year and what you can do to kind of mitigate that. So you can always go back to the show from last week to learn a little bit about some helpful tips about how to navigate the holidays, especially Christmas and New Year's. However, just on a regular basis, like I said, that's something that goes on a regular basis. So we always want to talk about, what people can do in order to get that under control. So yeah, so that's another thing we want to do. So this is kind of our, kind of year-end wrap up and kind of laying a path for going into 2026. It's not it's kind of a lot of my feelings and observations about things I see inside of the medical world and what I see being what I call low-hanging fruits for improving healthcare overall. And like I said, the common denominator a lot of times is going to be that education piece and people knowing what they have and what their options are and the learning and that knowledge gathering is driven a lot by whether or not you're willing to be humble enough to learn, humble and curious enough to learn. So that's where that comes from. And then in terms of the two biggest issues I see, like I said, the medication thing is huge because, like I said, you got a condition, that condition needs to be treated, and that treatment requires an adherence to the medical regimen or understanding why you're not going to take the pill. So if you say, "Hey, I don't want to take the pill," that's it may or may not be okay, but you know, you need to understand why you're not taking it, and you need to let people know that you're not taking it. And that's the only thing I say. Okay. So that's kind of, most of what we're talking about today. Like I said, last week we went over how to set some of these health goals. And, I think that, we want to make sure that you're setting that stuff up and, set yourself up some nice, simple health goals for 2026. Do not make them huge, especially those people that are starting out. Do not set huge health goals. Set things that you can obtain, whether that's, a daily movement, being aware of your blood pressure, hydrating more, just, hey, every morning I'm gonna get up, drink me a glass of water to get my day started. These sort of things are what you want. And then, like I said, I'm talking to the folks that, you are not doing anything. You're not doing anything at all with your health. For those folks, you really want to take those baby steps and you want to achieve those baby steps. Okay. The baby doesn't get up from crawling and start running sprints. Okay. It takes some little funky steps first. And then after a while, they start running. So for you, the ones that's been crawling, the ones that's been sitting on the couch, the ones that's been eating the chips, those folks, you want to make baby steps. And so that step may be, like I said, if you're eating a lot of processed food, kind of combing back out. Sometimes what you do is you actually just take an assessment of what's in you go look at your cabinet. What's in that cabinet? Like I said, you might if you got tons of chips and boxes and stuff, then hey, look, okay, all right, you know what I'm gonna do is I am gonna start when I take this bad stuff out, this bag of chips out, I'm gonna replace it with something healthier. This bag of chips is gonna be replaced by a bag of almonds, okay, roasted almonds, okay. So that may be what you wind up doing, and like I said, and it might be simple steps, and it might be gradual. But those are the things that are going to last for a long period of time. And we want this stuff to last. We want you to actually be healthier. We want you to be, you're going to seek health. You're going to seek this stuff out instead of having to be lectured about it. Go do something temporarily, and then next, 5 weeks later, you're back to where you were before. Okay, so that's kind of where we're gonna go. So that's it for today. Like we just wanted to make sure we touch base about how things went for 2025, kind of our thought process going forward to 2026. Some of the things we want you to do, which, like I said, medication reset, or medication check. We definitely want you to do a medication reset, and then, like I said, just how to think about your health goals kind of going forward. So yet again, I want to thank everyone, whether it's on WVOE or those that are listening on Pressure MD Academy over YouTube, Facebook. You want to thank all those for tuning in. I greatly appreciate it. Special thank you to WVOE, the voice of Ebony, for allowing me to have this space, this time, and for building this partnership over the years. We're looking forward to a strong 2026, and we're kind of go from there. All right. Thank you very much for tuning in, and everybody have a wonderful new year.